Health assessment. Health assessment, as the name says, assessment of health. So we have first characteristics of healthy person. Healthy person. They have a high level of self-esteem and inner locus of control. That is, they are confident of their ability to make competent decision. Inner locus of control. That is, they have compatibility to make competent decisions. Although healthy people have high regard up for themselves, they are not preoccupied with their personal identity or welfare, rather they are committed to goals other than their own personal welfare. Just as people living in pre-modern society place a low value on health and survival, healthy people place high values on these qualities. Healthy people are future oriented, willing to delay immediate gratification. For future gains, they are willing to invest in themselves, particularly through education. Healthy people constantly collect information to improve decision making, to increase security and reduce uncertainty. They are generally well informed and consider it important to form opinions on affairs beyond those that touch solely on private interest. Next, healthy people are trusting and easily enter into social networks, forming strong and persistent affectionate bonds. Next, healthy people relish companionship, yet because they have a high regard for themselves, they are not uncomfortable when alone. Indeed, periods of quiet contemplation and reflection are sought for their soul nourishing value. Beyond formal education, healthy people pursue knowledge of themselves as well as knowledge of the world around them. To understand and find meaning is a basic human need. A healthy person has a sense of coherence, a global orientation that expresses sense of coherence, a global orientation that expresses the extent to which has a pervasive, enduring through dynamic feeling of confidence that one's internal and external environments are predictable and that there is a high probability that things will work out as well as can reasonably be expected. Next topic is identification of deviation from normal health. Of deviation from normal health. Illness is a state in which a person's physical, emotional, intellectual, social, developmental, or social functioning is diminished or impaired compared with previous experiences. Illness, therefore, is not a synonymous with disease. Although nurses must be familiar with different kinds of diseases and their treatment, they are concerned more with illness, which may include disease but also includes the effects on functioning and well being in all dimensions. Then, classification of illness. We have acute illness and then chronic. Acute illness usually has a short duration and is severe. The symptoms appear abruptly and are intense and after subside after a relatively short period. An acute illness may affect functioning in any dimension. Example: cold, headache, stomach pain. Chronic illness persists usually longer than 6 months and can also affect functioning in any dimension. The client may fluctuate between maximal functioning, serious health relapses that may be life threatening. A person with a chronic illness is similar to a person with disability in that both have limitations in function resulting from either a pathological process or an injury. It is important to understand that clients with chronic diseases and their families are faced with a process called normalization in which they adapt to their disease. Then let's talk about illness behavior. People who are ill generally act in a way that medical sociologists call illness behavior. It involves low people monitor their bodies and interpret their symptoms, take remedial action, and use the healthcare system, personal history, social situations, social norms, and the opportunities and constraints of community institution can all affect illness behavior. Illness behavior displayed in sickness can be used to manage life adversities. Illness behavior can be coping mechanism. Example, illness behavior can result in clients being released from roles, social expectations, or responsibilities. Impact of illness on the client and family. Impact of illness on client and family. Illness is never an isolated life event. The client and family must deal with changes resulting from illness and treatment. Each client responds individually to illness, requiring nurses to individualize nursing intervention. The client and family commonly experience behavioral and emotional changes as well as changes in roles, body image, and self concept and family dynamics. Behavior and emotional changes. Behavioral and emotional changes. Individual behavioral and emotional reaction depends on the nature of the illness, the client's attitude toward it, and the valuables of illness behavior. Non life threatening illness evoke few behavioral changes in the functioning of the client or family. A husband and father who has a cold, example, may lack of energy and patience to spend time in family activities and may be irritable and prefer not to interact with his family. This is a behavioral change, but the change does not pass long. Some may even consider such as change a normal response to illness. Impact on family roles. People have many roles in life, such as a way earner, decision maker, professional, child, sibling, try to adapt to major changes resulting from a family member's illness. If a parent of an adult becomes ill and cannot carry out usual activities, the adult child often assumes many of the parent's responsibilities and, in a sense, becomes a parent to the parent. Such a reversal of the usual situation can lead to stress, conflicting responsibilities for the adult child, or direct conflict over decision making. The client and the family after require specific counseling and guidance to assist them in coping with the role changes. Impact on family dynamics. Because of the effect of illness on the client and family, family dynamics after change. Family dynamics is a process by which the family functions, makes a decision, gives support to individual members, copes with everyday changes and challenges. If a parent in a family become ill, family activities and decision making after come to a halt as the other family member wait for the illness to pass or the delay action because they are reluctant to assume the ill person role or responsibility because of the effect of illness. Family dynamics change. The nurse must view the whole family as a client under stress. Family planning care to help the family regain the maximum level of functioning and well-being. Severe illness, particularly one that is life-threatening, can lead to more extensive emotional and behavioral changes such as anxiety, shock, denial, anger, and withdrawal. These are the common responses to the stress of illness. Impact on body image. Body image is a subjective concept of physical height, weight, look, appearance. Some illnesses result in changes in physical appearance, and clients and families react differently to these changes. Reaction to client and families to changes in body image depend on the type of changes. Example, loss of limb of an organ. When a change in the body image occurs, such as results from a leg amputation, the client generally adjusts in the following phases: shock, withdrawal, acceptance, and rehabilitation. Impact on self concept. Self concept is a mental self image or respect of strengths and weaknesses in all aspects of the personality. Self concept depends in part on body image and roles, but also includes other aspects of psychology and spirituality. The impact of illness on the self concept of Client and family members may be more complex and less readily observed than the role changes. Self concept is important in relationships with other family members. A client whose self concept changes because of illness may no longer meet family expectation, leading to tension or conflict. As a result, family members may change their interaction with the client. We have assessment for newborn babies. Each newborn baby is carefully checked at birth for signs of problems or complication. A complete physical assessment will be done that includes every body system. Throughout the hospital stay, doctors, nurses, and other healthcare providers continually assess the health of the baby, observing for signs of problems or illness. Assessment may include APGAR score. It is one of the APGAR score. It is one of the first checks of your new baby's health. The APGAR score is assigned in the first few minutes after birth to help identify babies that have difficulty breathing or have a problem that needs further care. The baby is checked at 1 minute and 5 minutes after birth for heart and respiratory rates, muscle tone, reflexes, and color. Each area can have a score of 0, 1, 2, or with 10 points as the maximum. A total score of 10 means a baby is the best possible condition. Nearly all babies score between 8 and 10, with 1 or 2 points taken off for blue hands and feet because of immature circulation. If a baby has a difficult time during delivery, this can lower the oxygen levels in the blood, which can lower the APGAR score. APGAR scores of 3 or less often mean a baby needs immediate attention and care. Birth weight. A baby's birth weight is an important indicator of health. The average weight for term babies born between 37 and 41 weeks gestation is about 7 lbs, 3.2 kg. In general, small babies and very large babies are at greater risk of problems. Babies are weighed daily in the nursery to assess growth, fluid, and nutrition need. Newborn babies may often lose 5% to 7% of their birth weight. This means that the baby weighing 7 pounds 3 ounces at birth might lose as much as 8 ounces in the first few days. Babies will usually gain this weight back by 2 weeks of age. Premature and sick babies may not begin to gain weight right away. Most hospitals use and metric measurements are also taken of the each baby. These include the following: head circumference, abdominal circumference, length, head circumference, the distance around the baby's head; abdominal, the distance around the abdomen; length, the measurement from crown of head to the heel. Vital signs are temperature, pulse, and breathing rate. Temperature able to maintain stable body temperature in normal room environment. Pulse is normally 120 to 160 beats per minute in newborn. Breathing rate is usually 40 to 60 breaths per minute. A complete physical exam is an important part of newborn care. Each body system is carefully examined for signs of health and normal function. A doctor also looks for any signs of illness or birth defects. Physical exam of a newborn often includes assessment of the following: general appearance, skin, head and neck, face, mouth, lungs, heart sound and femoral in the groin, pulses, abdomen, genitals, and the anus, arms and legs. Gestational assessment. Assessing a baby's physical maturity is an important part of care. Maturity assessment is helpful in meeting a baby's need if the dates of a pregnancy are uncertain. For example, a very small baby may actually be more mature than it appears by size and may need different care than the premature baby. An examination called the Dubowitz-Ballard examination. Examination for gestational age is often used. A baby's gestational age often can be closely estimated using this examination. The Dubovich Ballard examination evaluates a baby appearance, skin texture, motor function, and reflexes. The physical maturity part of the examination is done in the first 2 hours of birth. The neuromuscular maturity examination is completed within 24 hours after delivery. Information often used to help estimate babies' physical and neuromuscular maturity are shown below. Physical maturity. The physical assessment part of Dubovit's Ballard examination looks at physical characteristics that look different at different stages of a baby's gestational maturity. Babies who are physically mature usually have higher scores than the premature babies. Points are given for each area of assessment with a low of -1 or -2 for extreme immaturity to as much as 4 or 5 for post maturity. The lanugo, the soft downy hair on baby's body. Plantar creases. These creases are the soles of the feet range from the absent to covering the entire foot depending on the maturity. Posture, square window, arm recoil, popliteal angle, scarf sign. How does the baby hold his or her arms and legs? Posture, square window is the how far the baby's hands can be flexed towards the wrist. Arm recoil, how much the baby's arms spring back to the flexed position. Popliteal angle. How far the baby's knees extend. Scarf sign, how far the elbows can be moved across the baby's chest. Heel to ear, how close the baby's feet can be moved to the ears. When the physical assessment score and the neuromuscular score are added together, the gestational age can be estimated. Scores range from very low for immature babies less than 26 to 28 weeks. For mature and post-mature babies, all of these exams are important means to learn about your baby's well-being at birth. By identifying any problems, your baby's doctor can plan the best possible care. Then we have geriatric assessment. Geriatric assessment is a multidimensional, multidisciplinary diagnostic instrument designed to collect data on the medical, psychosocial, and functional capabilities and limitations of elderly patients. Various geriatric practitioners use the information generated to develop treatment and long-term follow-up plans, arrange for primary care and rehabilitative services, or then facilitate the intricate process of case management, determine long-term care requirements and optimal placement, and make the best use of healthcare resources. Standard medical evolution in 3 general. It focuses on elderly individuals with complex problems. It emphasizes functional status and quality of life. It emphasizes functional. It frequently take advantage of an interdisciplinary team for providers. 5 eyes of geriatrics. Intellectual impairment, immobility, instability, incontinence, iatrogenic disorders. The geriatric assessment effectively addresses these and many other areas of geriatric care that are crucial to the successful treatment and prevention of diseases, disability in older people. We have components of geriatric assessment. Okay, like demographic data, chief complaint and present illness, past medical history, nutrition, medical, social, exercise, dietary assessment, selected laboratory tests, sleep, sexual activity, recreational activity, security, injury risk, substance use, community services, long term care, social networks, caregivers, financial security, healthcare coverage, transportation adaptation, antenatal examination of women. And in the cyanic, her name is registered and prepared antenatal card. Abdominal examination inspected for size, shape, skin, fetal movements confirmed by palpation, size of the uterus, shape of the uterus, oval or not shape, position of uterus. In the living fetus, we can feel movement. Pelvic palpation of the pollic palpation, palpation of grip, fundal palpation, lateral or umbilical palpation. Gait, way of walking must be noted. Height, weight, gait. Urine test. Nipple depressed, retracted, cracked or not. X-ray only see abnormality. After 6 weeks for protein rate of mother blood, HB, vaginal and speculum examination, there are always opportunities in the school environment to teach important health messages. Estimating the period of gestation.